For more on the vaccines arrivals, joining us from our Abuja studio is Professor Innocent Uja. He's the president of the Nigerian Medical Association, NMA. Thank you for joining us. We also have the National Incident Manager of the Presidential Task Force on COVID-19, Dr. Mukhtar Mohammed. Thank you both for joining us at this time.
Thank you very much, and good evening.
I'd like to begin my question from you, Dr. Mohammed, and this is many were wondering indeed when the doses, the vaccines would get here. Briefly talk us through the journey as to how we got to today.
Thank you very much for having me on this program. Good evening, viewers. Actually, this has been a very long journey. The PTF, in collaboration with the Federal Ministry of Health, as well as the National Primary Healthcare Development Agency, have been engaging with the global bodies, particularly the WHO, Gavi Alliance, and CEPI, to try to see how, in the midst of this rush to vaccines, that Nigeria is able to secure our fair share of this vaccine. There have been several discussions and negotiation in terms of the quantity, in terms of the order, which country gets its own first. And there has been a lot of pressure from our political leaders to ensure that Nigeria is not shortchanged in this process. We also how it played out in terms of the pressure on the manufacturing companies. We saw how they have shifted dates in terms of the quantities they promised to produce. And we saw how some other countries have grabbed these vaccines beyond what their population, just trying to ensure the safety of their own citizens. All this has delayed, our effort to ensure that we have these vaccines as soon as possible in the country. But today is a very remarkable day, and we are very grateful that at least this part of the promise from the COVAX facility has now been fulfilled. We have about 4 million doses in the country, and this is going to be rolled out as soon as possible. So it has been a really remarkable journey, but at last it is fulfilling that these quantities of vaccines have started to arrive now.
All right, let's go over to Professor Uja. I mean, it's been called the beginning of an end to a pandemic. Are you excited that we are now one step closer to controlling the pandemic?
Well, let me say that we are very delighted that this is a positive contribution to the national response on COVID-19. And it is my delight that the federal government has kept to its promise of giving us vaccines. As far as the end of pandemic is concerned, it's very difficult to say. It's too early to say. Now that we have got the vaccines and many more will come in, what will play out as a success is the way and manner these vaccines are being used and distributed, so that many of our people have access. I'm happy to say that, to note that those who are the front line, that's the doctors and other health workers at the front line, will receive the vaccines first, and then it goes to those who are 60 and above, and then, of course, those who have comorbidities of hypertension, diabetes, cardiac disease, and renal conditions, so that we reduce the morbidity and mortality as that are associated with COVID-19. So it's a good step, and we want to say that the government has kept its promise, and we should not relent. This is just the beginning. That should not prevent us from observing the NCDC protocol of regular hand washing and use of sanitizers, face mask use, and social distancing. Because we do not know the biology, clearly we do not know the biology of COVID-19. And we do everything to ensure that we protect our people from this dreaded virus. So I would say that today is a good day because the government of Nigeria has kept to its promise. And we pray that everybody will cooperate with the process, the NPHCDA, the Federal Ministry of Health, the PTF, and the service providers who are in the field should continue to give their support and render their services to ensure that our people are better placed so that we stay safe from the dreaded virus. Thank you.
Just before we hear from Dr. Mohammed on some of what you've mentioned, I'd like to ask about vaccine hesitancy. Members of the NMA, are they willing to take the shots of AstraZeneca vaccine?
Yes, of course. As you know, as doctors, we work based on science, and science has proven that this is effective. Let me just say clearly that there's no vaccine that is 100% safe. We are looking at the untoward effects or side effects. So individuals have their own idiosyncrasies, but that will not prevent doctors from taking the vaccines. Anything that will keep us safe, we will embark on. And if it's been taken by other countries and even among the blacks in the US, I think that we would participate fully in this process, because it was not easy to get the vaccine to begin with. It was competitive, and we're happy that Nigeria has been part of the first few. We are told that we're the third country in Africa, and that is good. 1, 2, 3. First 3, by any standard, is good enough. And I would want us to cooperate. My colleagues and other health workers should cooperate with the government and the MPHDA, so that the process of the vaccination will be seamless. If that is done, then of course we will achieve. And of course, I must say that in doing so, we must document, because that is where we fall inadequate. We rush to it, and without proper documentation, we will not be able to say this is what. Even the follow-up, those who we give must follow them up, to look at those who probably will have one untoward effect or the other, for documentation. Because not only that we need to know this, we also publish this, so that in the end, the international community will know what Nigeria has contributed to the body of knowledge in the use of vaccine.
Thank you, Prof. Let's hear from Dr. Mohammed now. And this is on some of the challenges Professor Uja has mentioned: distribution, logistic issues, and all of those preparations, ensuring that it really gets to the people it's meant for.
Yeah, certainly. As far as the preparations are concerned, we have been briefed adequately at the PTF by the Federal Ministry of Health, as well as by the National Primary Healthcare Development Agency. We are confident that the preparations have been quite adequate. Cold storage facilities have been assessed, and we have enough capacity to store these vaccines and also to store even more consignments that are to come. Health workers have been prepared. Trainings have been going on at various levels. In Abuja here at the federal level, they have done the state trainings. They have cascaded down to training the people in the primary healthcare facilities who will be administering these vaccines. It is an elaborate plan, and everything for now is going on in accordance with the plan. This is not to say that we may not have some small hitches in terms of logistics or in terms of deployment of people to the field when necessary. But it is also pleasing to understand that we have backup plans, arrangements to be made in case there is delay in terms of delivery of these vaccines, and in terms of shortage, in terms of number of people registered to be able to move vaccine from one point to another. You will recall that people are, the website or the link has been sent out where people can now register and get themselves ready for the vaccine. So this link is available and people are already registering. We know that there may be some technical hitches, particularly with the IT part. People should not panic, and people should not run to conclusion that this is not going to work. We know that every IT system has challenge. And imagine when you have about hundreds of thousands of people, trying to register at the same time. So sometimes it can freeze. You can have some small glitches, but these are all being fixed
all right, Doctor.
So just to reassure Nigerians that all the logistics arrangements are being put in place, and we are ready to commence the vaccination
We'd like to thank you. I'd like to thank you both and congratulations. The first step to controlling the pandemic. We would like to thank the National Incident Manager, the Presidential Task Force on COVID-19, Dr. Mukhtar Mohammed, and Professor Innocent Uja, President of the NMA. Thank you for talking to us.